What if your kidneys were struggling right now and you don't even know it? No pain, no warning. No dramatic sign telling you something is wrong. That is not a scare tactic. That is the reality thousands of people discover every single year, not because they felt something terrible, but because a routine blood test revealed something they never expected. Her name was Margaret. She was 47 years old, a school teacher from Ohio, a mother of 3, the kind of woman who never missed a parent-teacher meeting, always had dinner on the table by 6, and hadn't taken a sick day in 11 years. She was tired, but she had 3 kids and a full-time job, so tired made sense. Her shoes felt tighter in the evenings, but she'd been on her feet all day, so that made sense too. She wasn't as hungry as she used to be, but she was getting older and her appetite had always gone up and down. None of it seemed urgent. None of it seemed connected. Until a routine blood test before a minor procedure revealed that Margaret had been living with stage 3 chronic kidney disease for years. Years without knowing. Her doctor told her that her kidneys had likely been struggling for a long time, that her body had been sending signals, that if she had come in just a little sooner, certain things might have gone differently. Margaret said something her doctor never forgot. She said, "I thought I was just tired. I didn't know my body was asking for help." One of the most dangerous things about kidney disease is that it often develops quietly. Many people assume they're simply getting older. Others blame stress. Some blame work. Some blame poor sleep. And because the symptoms can feel so ordinary, they often go unnoticed. The truth is that your body may be trying to get your attention long before a diagnosis is ever made. The question is, would you recognize the warning signs? Today, we're going to talk about some of the symptoms people often overlook, misunderstand, or dismiss. Not to frighten you, but because paying attention to your health today could make a difference tomorrow. And before this video is over, you may discover that a symptom you've been ignoring deserves a second look. If this kind of content matters to you, do me a favor right now. Hit the like button so more people can find this video. It costs you nothing, and it could genuinely help someone who needs it. Before we talk about the warning signs, let's take a moment to understand what your kidneys actually do. Most people know they filter waste from the blood, but that's only part of the story. Your kidneys help control blood pressure. They balance fluids throughout your body. They regulate important minerals like sodium, potassium, and calcium. They help produce hormones that support red blood cell production. They help keep your bones strong and healthy. In other words, your kidneys are working around the clock, every single day, to keep your body functioning properly. And here is the part that makes kidney disease so particularly dangerous. Many people can lose a significant amount of kidney function before noticeable symptoms appear. The kidneys are remarkably resilient. They compensate. They adapt. They keep working even when they are struggling. Which means by the time obvious symptoms show up, the disease may already be more advanced than anyone realized. That is why awareness matters. That is why this conversation matters. Let's talk about the signs. Let's start with one of the most common warning signs, and the one most people dismiss first. Fatigue, not normal tiredness, not the kind that improves after a good night's sleep or a quiet weekend. We're talking about the kind of exhaustion that follows you everywhere, the kind that is there when you wake up and still there when you go to bed, the kind that makes simple tasks feel heavier than they should. You wake up tired. You go through the day tired. You struggle to focus. You feel drained even after activities that never used to slow you down. Many people immediately blame stress. Others blame age. Some assume they simply need to eat better or sleep more. But here is what is actually happening. When kidney function begins to decline, waste products that should be filtered out of the bloodstream start to accumulate. Those toxins circulate through your body and can leave you feeling profoundly weak and exhausted. In addition, kidney disease can contribute to anemia, a reduction in healthy red blood cells, which means less oxygen is being delivered to your muscles and organs. The result is constant fatigue that rest alone cannot fix. Have you been feeling exhausted despite getting enough sleep? Have your energy levels changed significantly over the past year? It is something worth paying attention to, not panicking over, just paying attention to. One man described it as feeling like his battery never fully charged. He would wake up tired, work tired, and go to bed tired. For months, he blamed stress and a busy schedule. It wasn't until a routine checkup that he learned his kidneys were not functioning as well as they should. At first, he thought he simply needed more sleep. But the real problem wasn't a lack of rest. It was a health issue that had been quietly developing in the background. That is why persistent fatigue should never be ignored. Now let's talk about swelling, a symptom that surprises many people because it seems so easy to explain away. You notice your socks are leaving deep marks around your ankles by the end of the day. Your shoes feel tighter than they did 6 months ago. Your fingers look slightly puffy. Your face seems swollen when you look in the mirror in the morning. And the first explanation that comes to mind is usually, too much salt yesterday, too much time on my feet. It will go away by tomorrow. Sometimes that explanation is correct. But persistent swelling, swelling that keeps coming back, swelling that doesn't improve with rest, swelling that is spreading, deserves more than a simple explanation. Healthy kidneys help remove excess fluid from the body. When kidney function declines, that fluid has nowhere to go. It begins accumulating in the body's tissues. This is called edema, and it can show up in the feet, the ankles, the legs, the hands, and even the face. Think about Margaret, the school teacher from Ohio. She noticed her shoes feeling tighter every evening for months. She thought it was because she spent long days on her feet. She wasn't wrong that standing contributed to it. But what she didn't know was that her kidneys were no longer managing fluid the way they should have been. If swelling in your body has become persistent or is getting worse over time, that is a signal worth bringing to a doctor. Here is a warning sign that many people notice but rarely talk about, even to their doctor. Changes in urination. Your urine can tell you a great deal about what is happening inside your body. And when the kidneys are struggling, those changes often show up here first. Have you started waking up more frequently during the night to use the bathroom when you rarely used to before? Have you noticed your urine looking foamy or bubbly? Have you seen any pink or reddish discoloration that could indicate blood? Has the color become persistently darker than usual? Has the amount you're producing changed significantly, either much more or much less than normal? Foamy urine in particular can be an important signal. It may indicate that protein is leaking into the urine, something that healthy kidneys should prevent. Blood in the urine is always something that requires medical evaluation. None of these changes automatically mean kidney disease. There are many possible explanations, but they are signals your body may be sending, and they should not be ignored or waited out indefinitely. If you have noticed changes in your urination that have lasted more than a few days, bring it up with your doctor. Even if it turns out to be nothing serious, you will have peace of mind. And if it does point to something, early knowledge gives you options. This is the warning sign that surprises people most. Loss of appetite is not something most of us connect with kidney health. We connect it with stomach problems, with stress, with mood, not with our kidneys. But here is what happens. When the kidneys are not filtering the bloodstream efficiently, waste products begin to build up. One of the effects of this buildup is that it can affect how food tastes and smells. Meals begin to lose their appeal. You sit down to eat and find yourself pushing food around the plate. Portions get smaller without a conscious effort to diet. Some people feel mildly nauseous, especially in the mornings. Some people lose weight without trying. Many people are actually pleased when this happens initially. They think they're naturally eating less, finally losing some weight. But unexplained appetite changes, especially when combined with any of the other symptoms in this video, should never be ignored. Your body needs nutrition. When it stops asking for it persistently, that is worth investigating. We are about halfway through this video, and I want to take a quick moment to say, if you are finding this helpful, please save this video. Share it with someone in your family or your circle who you think should hear this. You never know whose life a conversation like this might change. Now let's continue. This is the warning sign that almost nobody connects to kidney disease. Itching. Not the kind from an insect bite or a patch of dry skin. We are talking about persistent, widespread itching that does not have an obvious cause and does not respond well to creams or moisturizers. When waste products build up in the bloodstream because the kidneys are not removing them efficiently, those substances can sometimes trigger itching throughout the body. It can be relentless. People spend months trying different lotions, switching laundry detergents, seeing dermatologists, never realizing the issue is not coming from the skin at all. If you have been dealing with unexplained itching that won't go away, and especially if it is accompanied by any of the other symptoms in this video, mention it to your doctor. Here is one that often gets dismissed as a personality trait or a consequence of modern life. Brain fog, difficulty concentrating, poor memory, mental fatigue that makes it hard to think clearly, forgetting things mid-sentence, walking into a room and completely losing why you went there. Many people blame stress. Others blame the demands of a busy life. Some assume it is simply a natural part of getting older. But when the kidneys are not adequately filtering the blood, toxins that should be removed begin circulating through the body, including through the brain. This can genuinely affect cognitive function. It can make thinking feel slower and harder than it should be. If you have noticed a significant and persistent change in your ability to concentrate or remember things, and it is accompanied by other symptoms on this list, it is worth mentioning to a healthcare professional. Occasional muscle cramps happen to everyone. But frequent painful cramps, especially in the legs, can sometimes signal something deeper. Your kidneys play an important role in maintaining the balance of electrolytes in your body. Sodium, potassium, calcium, phosphorus. These minerals need to stay in careful balance for your muscles and nerves to function properly. When kidney function declines, those balances can be disrupted. The result can be muscle cramps that are more frequent, more painful, and harder to explain than the occasional cramp after exercise. If your cramps have become a regular part of your life without a clear reason, add it to the list of things to discuss with your doctor. This one surprises people most when they hear it connected to kidney disease. Shortness of breath, climbing a flight of stairs that never bothered you before, getting winded during a short walk, finding that daily activities require significantly more effort than they used to. There are two ways kidney disease can contribute to this. First, when excess fluid accumulates in the body, it can sometimes affect the lungs, making breathing feel more labored. Second, the anemia that often accompanies kidney disease reduces the oxygen-carrying capacity of the blood, which means your body has to work harder to get oxygen where it needs to go. Many people assume they have simply become unfit. They push through it. They avoid the activities that leave them breathless rather than asking why it is happening. Persistent, unexplained shortness of breath should always be evaluated by a doctor, regardless of the cause. Before we continue, take a moment and ask yourself a few honest questions. Have you been feeling more tired than usual? Have your shoes, socks, or rings started fitting tighter? Are you waking up more often at night to use the bathroom? Have you noticed changes in your appetite? Are you experiencing brain fog, itching, or unexplained shortness of breath? One symptom alone may not mean anything serious, but when several appear together, your body may be trying to get your attention. The purpose of this video is not to make you worried. It is to help you become more aware, because awareness often comes before diagnosis, and early diagnosis can make a significant difference. Let's talk about who is most likely to develop kidney disease, because if you fall into one of these groups, what we've discussed today becomes even more important for you personally. People with diabetes are at significantly higher risk. High blood sugar over time can damage the small blood vessels in the kidneys. In fact, diabetes is one of the leading causes of kidney disease worldwide. People with high blood pressure face elevated risk as well. The pressure can damage kidney tissue over time in ways that are gradual and initially invisible. People with obesity, heart disease, or a history of frequent urinary tract infections also have higher risk. People who smoke, and importantly, people with a family history of kidney disease. Genetics plays a role that many people underestimate. If you recognize yourself in any of these categories, regular kidney screening is not optional. It is essential. Let's take a moment to address some of the most common myths about kidney disease, because misinformation keeps people from getting checked. Myth 1: kidney disease always causes pain. This is one of the most dangerous myths. Many people wait for pain as their signal to seek help. But in the early and middle stages of kidney disease, pain is often absent entirely. The kidneys themselves do not have many pain receptors. By the time pain becomes significant, the disease may be advanced. Do not wait for pain. Pay attention to the quieter signals. Myth 2: only older people get kidney disease. Not true. While age is a risk factor, kidney disease can and does affect younger adults. It affects people in their 30s and 40s. It affects people who consider themselves healthy and active. Myth 3: you would automatically know if something was wrong. This is perhaps the most dangerous myth of all. Margaret, the school teacher we talked about at the beginning of this video, did not know. Many people discover kidney disease through a routine blood test they almost didn't bother scheduling. Your body is often more patient with you than you deserve. It compensates. It adapts. It keeps going. Which means the warning signs can be subtle enough to ignore until they aren't. The good news, and there is genuine good news here, is that kidney disease can often be detected through simple, accessible tests. A blood test can measure creatinine levels in your blood. From that, your doctor can calculate your eGFR, your estimated glomerular filtration rate, which shows how well your kidneys are filtering waste. A urine test can check for protein and other abnormalities. Blood pressure monitoring provides additional important information. These tests are not complicated. They are not expensive. They are often part of a routine annual checkup. And in many cases, early detection creates significantly more treatment options and better outcomes. If you have not had a kidney function test recently, and especially if you have any of the risk factors we discussed, ask your doctor to include one at your next visit. Let's end with action, because information without action is just worry. Here's what you can do right now to protect your kidney health. Control your blood pressure. High blood pressure is one of the leading causes of kidney damage. Know your numbers and manage them. If you have diabetes, manage it carefully and consistently. Work with your healthcare team to keep your blood sugar stable. Stay physically active in a way that is sustainable for you. You do not need to run marathons. Consistent, moderate movement makes a meaningful difference. Maintain a healthy weight. Obesity increases the strain on the kidneys over time. Avoid smoking. Smoking reduces blood flow to the kidneys and accelerates damage. Take medications only as directed. Some over-the-counter pain medications, taken regularly over long periods, can be hard on the kidneys. Stay hydrated. Water helps the kidneys flush waste. Not excessive amounts, just consistent, adequate hydration throughout the day. And attend your routine medical checkups, even when you feel fine, especially when you feel fine. Margaret, the school teacher from Ohio, is managing her kidney disease today. It is not the outcome she would have chosen, but she has made adjustments. She is monitored regularly. She is informed. And she says that the thing she wishes most is that someone had sat her down years earlier and told her what her body was trying to say. So consider this that conversation. Your kidneys work for you every minute of every day, silently, without complaint, without asking for recognition. The least we can do is pay attention. If you have been experiencing ongoing fatigue, persistent swelling, changes in urination, loss of appetite, unexplained itching, brain fog, muscle cramps, or shortness of breath, please speak with a healthcare professional. Not to panic, just to know. Because when it comes to kidney disease, early awareness can change everything. Share this video with someone you love, a parent, a sibling, a friend who you know hasn't been to the doctor in too long. Sometimes the most important thing we can do for the people we care about is hand them information at the right moment. Thank you for watching, And remember, sometimes the smallest symptoms deserve the biggest attention. Your body is always talking. Learn to listen.